Hi, my name is Dr. Bowles and I am a neurologist in private practice. Welcome to our video on understanding stroke. We will discuss what a stroke is, the two types of stroke, and how they affect the brain. A stroke occurs when the blood supply is disrupted to the brain, depriving the brain cells of oxygen, causing them to die. This can occur if there is a blood clot in a vessel, obstructing blood flow to the brain, or if the vessel leaks or ruptures, causing blood to go into the brain tissue or the surrounding tissues. These are categorized as either ischemic or hemorrhagic strokes respectively. The longer the brain is deprived of oxygen, the worse the brain damage becomes. Time is therefore brain. Sometimes, after the initial stroke, the patient may deteriorate further, and this could usually be due to swelling of the damaged brain tissue or expansion of the blood clot from the hemorrhagic stroke itself. You can think of an ischemic stroke as a hose pipe with a rock stuck in it, obstructing the flow of water, and you can think of a hemorrhagic stroke as a hose pipe that has a leak or has burst, letting the water pour out. Both types of stroke can lead to a variety of different neurological symptoms. This can vary from weakness, from sensory loss, visual disturbances, dizziness, vertigo, even speech and language problems. This all depends on where in the brain the stroke occurs. So, generally speaking, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. So for example, if you have a stroke in the right side of the brain, a patient may present with numbness or weakness on the left side of the body. It is important to note that the brain is, however, complex, and this may not always be the case. Recovery after a stroke can be a long process, and the prognosis is dependent from patient to patient. There are a lot of different risk factors that are involved in predicting how well the patient will recover. For example, this will depend on the baseline medical health or status of a patient before the stroke, the size of the stroke, how long was the brain deprived of oxygen, was any intervention done, and were there any complications following the stroke. I really hope that this video has helped you understand the concept of what a stroke is and what is currently happening with the patient.